Many women were taught to hover over public toilets or make a trip to the bathroom just in case before leaving the house. But health experts say these common habits could actually be doing more harm than good, potentially weakening your pelvic floor muscles over time.
Yeah, many women have heard of the pelvic floor, but most, they don't really know much about it. It's kind of a mystery. So here today to answer some of the questions you may have about the pelvic floor health is Dr. Stephanie Hack. Thank you so much for joining us, Dr. Stephanie.
Thanks for joining us.
Thank you for having me.
Yeah, so let's go ahead and jump right in. So what is the pelvic floor?
Yes, I'm glad you asked. So in our pelvis, and this is something that everybody has, it's not specific to women, but we have muscles in our pelvis and they act kind of like a cradle or a hammock, and they hold up all of the organs that sit in our pelvis. So for women, like your uterus, your cervix, your bladder, your rectum, these things are held in place by muscles and connective tissue, and that is called the pelvic floor.
So how do you notice when you're getting maybe a pelvic floor problem or an issue happening where it's like weakening? What should someone do?
Sure. So one of the most common things that people begin to report is feeling a bulge. So they may feel a bulge in their pelvis, and that's something called pelvic organ prolapse, and that's a sign of pelvic floor dysfunction or problems with the pelvic floor. But something else is they can start to have problems with their bladder. So bladder functioning, not being able to pee, not being able to have bowel movements like they did before. And they can also have sexual dysfunction as well. So there are a number of things that play into that.
And so who is most at risk for pelvic floor disorders? Are things like childbirth, age, or lifestyle habits major contributors?
They are. So being pregnant, regardless of the type of delivery that you have, is a risk factor, but then also vaginal deliveries. In addition, things like someone with chronic constipation, someone who smokes, someone with obesity, all of these things put extra stress on those muscles, and so that's why it increases the risk factors.
And when should someone go to a doctor if they're having some of those symptoms?
Sure. So the second you start to feel a bulge, or if you notice, oh, I can't quite pee the same, or I can't have a bowel movement like I did before, those are all reasons to initiate the conversation with your doctor.
And there's a lot of misinformation out there. So what are the biggest myths about pelvic floor health that you can kind of debunk for us today?
Oh, definitely. I'd say there are two main ones. One, that it's normal when people start to have pelvic floor problems. A lot of times when we age, we think, oh, that's normal. Normal and common are not the same. So just because something is more common as we get older doesn't mean it's normal. Normal makes you feel like you don't need to get it checked out. You should still get it checked out. And then the other one is that it only happens for us as we get older. But you can also have pelvic floor dysfunction in younger women, especially if they're postpartum, if they've had kids.
And we talked a little bit earlier about if a woman goes to like a public bathroom, you're kind of like squatting over the toilet. Is that something that we should steer clear of, or is that a myth as well?
I hate to say it, but you don't want to put stress on your pelvic floor. So wipe the seat down, put down your toilet tissue or whatever you do, and just sit. Don't strain those muscles.
And anything that you can just provide for us in terms of, demographics, are there specific demographics that are more prone to having these issues?
Sure. So pelvic floor dysfunction is more common after 40. So it's really only about 1 in 10 women that have it kind of from 20 to 40, but then it gradually increases the older we get because those risk factors like obesity increase. We also experience hormone changes and things that can also affect our pelvic floor muscles. And, you're more likely to have finished your pregnancy and childbirthing and gone through all of that. So really, the older we get, those things become more common.
What are some ways that you can strengthen your pelvic floor? I've heard about Kegel exercises. I don't even know if I'm saying it correctly, Kegel, but
Yeah.
Is that a way that you can strengthen your pelvic floor muscles?
They are, but they're not for everybody. And I say that because with pelvic floor dysfunction, often those muscles, what we talk about, the muscles are getting weaker, but for some people, they have tight muscles and they're overactive. So actually doing Kegels can make it worse. But for people who have weak pelvic floor muscles, then the Kegels can help. So always begin begin the consultation with your physician, and they can kind of inform you if Kegels make sense for you. But then also doing things like stop smoking, maintain a healthy weight, manage constipation so that it doesn't get too bad, stop hovering over the toilet, just reducing all of those other risk factors.
All right, Dr. Hack, thanks so much for joining us.
Thank you.
All right, for more information on women's health and Dr. Hack's podcast, visit ladypartsdoctor.com.